10 weeks ago, I underwent surgery for endometriosis where I had a laparoscopy and I was officially diagnosed with stage 2 endometriosis on my bladder, my bowel and the back of my womb, as well as removing a rather large cyst that had formed on my left ovary. I wanted to record this video and I wanted to talk about my whole journey from the very first time I think I felt a symptom to right now in my recovery post-surgery journey. The reason I wanted to do this was because over the last, it must be just under a year since the conversation started about endometriosis with me. Since then, I've discussed it online, I've opened that conversation, and I've had several women come up to me and be like, oh my God, I had no idea this existed. Or people coming up to me going, I think I have this. Or women saying, I've been dealing with this for 10 years. And I hope that with this video, I can educate more people as to what to look out for, how it affects people, and the process of endometriosis as a whole. I want to start by saying that 1 in 10 women will have endometriosis. It is an incredibly common thing. Most likely, someone you know of will have endometriosis. The average length of diagnosis is around 8 years. I'm incredibly lucky that my diagnosis length was around 4 months to the first sort of potential diagnosis, and then around 10 months to my formal diagnosis, which is ridiculously quick for endometriosis. However, when it was first talked about, that is not the first time I had a symptom. I'm gonna go way back, all the way to, I think it was December 2019 that I had my first severe symptom. I remember very clearly being in my flat in London. All of a sudden, the most severe excruciating pain I have ever felt happened in my stomach. I can't explain it. It came out of completely nowhere, but it was so severe that I completely panicked. I called my parents, I called my boyfriend at the time, called 111, and their response was that they wanted to get an ambulance out to me. I eventually came around to a point where I could manage it, but at the time it was happening, I couldn't breathe, I couldn't move, I couldn't stand up. It was hideous. I sort of palmed it off. I just figured, my periods are painful. I then had a second experience in February 2020. Very similar pain. I was walking, I'd just been out for lunch, but we got about halfway down the road. And again, I was just overcome with agonizing, excruciating pain. I could no longer take a step. I went green. Started to notice that around the same time, that when I would go to the toilet, when I would pee, it just felt like there was a massive amount of pressure in my sort of reproductive area. More often than not, when I'd stand up after peeing, I couldn't stand up straight. It felt like there was something in me that was restricting my movement. I also started feeling around this time, when I would go for long walks or when I would move for long periods, that occasionally coming from a walk and I'd sit down perhaps, and I couldn't sit properly because it felt like my pelvis was uncomfortable where it was sat. None of these symptoms, none of these things are reasons I even went to the doctor in the first place. When the pandemic hit, much like everybody else, I was very stressed, I was very anxious, I was very uncomfortable, and I started noticing that I was bloating a lot and I had a pretty much persistent stomachache for about 3 months. About 3 months into the stomachache, I went to the doctor and I just said, something's going on. So we did bloods, he put me on some medications that I had to eat wheat for 6 weeks, and then he would do a celiac test. So I did that, I did all that, and I was still having these stomach aches. I went in for an examination, just like an examination of my stomach, after we decided the medication wasn't working, and he sort of pressed around on my tummy, and I mentioned that the pain actually wasn't in my stomach area, it was in my lower abdomen. And I said that it was very tender, pretty much all the time, and that's where my bloating was coming from. He said, okay, here's this, I'm going to send you for an ultrasound. And my doctor spoke to me and he said, you have a large cyst on your ovary, about 1 centimetre wide, 1 centimetre long, which doesn't sound like a large cyst, but when you think about all the things that are around that area, that's an extra centimetre that those other organs have to make space for. However, ovaries do sort of naturally produce cysts. So the procedure then was that we were going to wait out for 6 weeks, see if it burst on its own. They said it'd probably be quite painful, but that hopefully it would burst on its own and I wouldn't have to go forward with anything else. Wait 6 weeks, nothing changed. I was still experiencing pain, and they scanned it again and it had changed in diameter. At this time, I'd also discussed the pain whilst I pee, the pain I felt on a daily basis, and a couple of other symptoms that I felt like might be related to my tummy issues. So the same doctor called me up and he decided that the possible outcome of this was that it was an endometrioma, which is essentially a cyst, but it's connected to endometriosis as opposed to polycystic ovarian syndrome, which is another condition that affects the same sort of area. He then informed me the next step was in fact to see a gynecologist and arrange for surgery if he felt like my endometriosis could be bad enough. I went to the gynecologist and it was pretty much a unanimous decision. He said, whatever it is, I want to remove this cyst, and if there is anything else then we'll remove it then. That was back in September. And initially I was told the waiting period for my surgery would be about maybe 2 months. So I expected to have surgery around December. It didn't happen in December. I had my pre-op at the beginning of January. I remember it was the 9th of January I had my pre-op assessment. And the general consensus was that in the next couple of weeks I would have had my surgery and everything would be done. However, that did not happen. COVID had another plan, and the hospital I was meant to have my surgery at essentially just stopped doing surgeries when we were in that really nasty, scary bout of COVID. So with that being said, I went from January and I finally had my surgery in April, 4 months later. It was a massive surprise. They literally called me, I think on the 10th of April, the 9th of April, and they were like, hey, do you want to come in and have surgery next week? And I was like, great, okay, let's go. I didn't, I had a few meltdowns, but I was terrified. Obviously I had to isolate for a few days beforehand. I was incredibly lucky that we found somewhere that I could isolate that was close enough to the hospital, but wasn't with anybody who couldn't isolate, obviously. And actually the isolation period was absolutely fantastic. It was so nice to just have nothing to do. I went in for my surgery. I was terrified. I was so scared. I knew it was gonna be a day surgery. I knew it was gonna be a quick one. I knew I'd done all the research, but the people who worked at Bournemouth Hospital the day I had my surgery, I feel like I want to like cry about them because they were just fantastic. I had a gorgeous woman who was around my age as the person who collected me and took me to the anaesthetist. She was everything I needed that day. She was so much fun and she was loud, she was excitable, and I needed that. And she held me whilst I sobbed, whilst the anaesthetist was doing his thing. I came around to a wonderful man named Steve, who I think the first words I said to him was, "You are the best thing I've seen all day." I was very grateful to wake up to someone who was being so sweet. I was just very grateful to wake up. God, I was an anxious mess. Anyway, I had the surgery and that's where they gave me my formal diagnosis, and they essentially found what I told you earlier. They found stage 2 endometriosis on my bladder, which explained why peeing was so uncomfortable. They found it on my bowel, which explained why you know what is an issue, and they found it on my womb, which explained why the other you know what is an issue. And I have to say, I think as much as I don't want endometriosis, I don't want it, I was incredibly grateful just to have that reassurance that I did in fact have endometriosis and it was nothing else. Recovery was slow. I had never had surgery before. I'd never been under anaesthetic before, so my body took a little while to chill, and slept pretty much for the first 3 days. I was very lucky that I had people to look after me, and I now have 3 scars. I have a scar on my left ovary, and I have a scar on my right ovary, and I have a scar on my belly button. Lots of people have asked me whether surgery means that I no longer have endometriosis, and unfortunately the answer is no. Surgery is a temporary thing. It removes anything that's in my body at that time, but endometriosis is something that will always come back. The majority of women end up having surgery once every 3 years, once every 4 years, potentially even more than that. It's tough. It's very difficult to sort of come to grips with, and I think I've taken time to come to grips with it. I don't think I'm fully there yet. I mean, making this video took me a number of weeks, and I've attempted to film it, and I've filmed it, or filmed some of it, and then deleted it about 3 or 4 times now. It's not an easy conversation to start, because I think it opens a lot more questions than I'm maybe ready to answer, maybe that I even know the answer to. But I think it's important that we have these discussions. It's important that we tell people how long this can take and how debilitating this condition really can be. It is said that endometriosis is as painful as a heart attack. All I know is that endometriosis is the worst and most excruciating pain I have ever felt. And normal methods of pain relief don't even touch the sides. As I said, I am now 10 weeks later, and I've had a few days where my pain is almost as bad as it was. It hasn't got right back there yet, but I do expect that it will eventually. For the time being, I do now have a hormonal coil. The idea of the hormonal coil is that it will eventually reduce my periods, make them lighter, potentially make them go away completely. If I have lighter periods or I have no periods, there's a much, much smaller chance of my endometriosis coming back or coming back as worse as it was. There are many other symptoms of endometriosis. Endometriosis can occur on any organs on the body, anywhere. I have heard of it coming up on the liver, I've heard of it coming up on your lungs. Like, it's quite scary, but it can happen. My pain in comparison from January to right now, I'm probably experiencing 60%, maybe 70% less pain than I was experiencing back then, and that is from the surgery. My advice to anybody who thinks they potentially could have endometriosis or knows somebody with endometriosis is persevere. Get a second opinion. If your doctor is standing there telling you that they don't think it's endometriosis, they think it's in your brain or whatever it is they want to tell you, get a second opinion. You have the right to tell somebody, I think you're wrong, I'd like to see somebody else. If you're experiencing really painful periods, know that periods should not be painful. They shouldn't be painful. You shouldn't be experiencing any sort of discomfort that puts you in a position where you're not able to do your normal things. Periods should not be painful. They should be at most an inconvenience. If anyone's telling you any different, go see somebody else. There are people out there who will believe you, I promise you. I just want to say thank you for watching. Thank you for being interested. Thank you for hearing me out. Thank you for listening to my story. Remember, my DMs are always open, and I hope you have a nice day.